Fentanyl has become synonymous with the crisis of opioid addiction in America. It's easy to produce, readily available on the black market, but it does have a medical use, providing relief to millions suffering from chronic pain. WGNO's Amy Russo tells us about the differences between pharmaceutical and illegal fentanyl and what we are seeing here in Louisiana.
In 2022, Opioid Help Louisiana reports over 1,400 people in the state died with opioids to blame. Of that, over 1,200 were because of synthetic opioids like fentanyl. The CDC says fentanyl remains the deadliest drug threat in the U.S. But what is it, and how did we get here?
Fentanyl is a synthetic opioid that we use to treat pain.
That's Dr. Catherine Oliver with Clinical Pharmacy Services at Ochsner. Fentanyl actually started as a common drug used in the hospital to control pain. It's more potent than most opioids, including morphine.
We can give it to you in surgery. We can give it to you also like in the ICU when we're trying to keep you comfortable when you're critically ill. There are also some compounding pharmacies that will make it in different forms like lozenges. So for patients, again, who maybe can't swallow and that sort of thing, they'll use that or lollipops.
But like any opioid, it carries the risk of addiction. And when you take to the streets to get your fix, you never know what exactly you're getting.
But we do see that it laced with other illicit or street medications, and that's where we really see the devastating effects because it is so much more potent than other opioids. If you aren't aware that it's in what is being used, that's when we see unexpected and unintended overdoses.
These are typically chemicals that are sourced in one country. They're brought to a second country outside of the U.S. They're produced in an illegal lab, and then they're smuggled into the United States.
Dr. Daniel Sessions has been with Ochsner for 2 years. He's the chief of medical toxicology. He says every few hours, a person comes into one of Ochsner's ERs ODing on fentanyl. A lot of the time, those using don't even realize they're taking the drug.
People are taking these fentanyl chemicals and the fentanyl itself, and they're making them into pills. And the pills are usually disguised to look like other medications that people are trying to use, misuse, or abuse. Percocet, oxycodone, Xanax, things that we're used to using. If you have a pill that you think contains 30 milligrams of oxycodone, 60% of the time, it doesn't contain that oxycodone. It contains a lethal dose of fentanyl.
Since the COVID-19 pandemic nationwide, the use of synthetic opioids, primarily fentanyl, has skyrocketed. Check out this graph from the CDC showing overdose deaths. That gray line shows just how big of a jump was made from 2020 to 2022.
And so we've seen an increase in those fentanyl overdoses. We've seen an increase in those fentanyl exposures, and we've seen an increase in addiction, unfortunately. And that was probably exacerbated by the COVID pandemic and kind of the stress of that.
If you find yourself struggling with addiction, Dr. Sessions has some advice for you.
If you're really, at the end of your rope and you're not sure what to do, there's the emergency department. There's a lot of groups like in New Orleans, like Metro Human Services and Behavioral Health Group, who are very good about in very short term getting you in for addiction treatment, even if you don't have financial resources.
Amy Russo, WGNO News.
Dr. Sessions wanted to be clear that no one demographic is more at risk of becoming addicted to fentanyl. If you are prescribed it, use it only as directed.